Okay, I am back on. Hopefully you can hear me now. I'll type something in here. Can you? All right, looks like I had a problem there with the connection. Hopefully I'm of a better connection. Can you hear me now? I got a couple people joining, coming back in here. All right, can you hear me now? I think I wrote that in there in my chat. I see you back, Sam. I see you back, Chris. Am I heard? Hi, Viral. Well, okay, at least I can be heard now. All right, I must have had a problem with my connection there, so sorry about that. I must have froze up on you guys there. Okay, so I just restarted it. All right, I'm going to go into some of the illnesses here right now on the systems. All right, first one I'm going to talk about is one called Alzheimer's. You may have heard of that. So if you've heard of Alzheimer's, you could write yes in the chat room, or if you know something about it, you could write something about Alzheimer's there. Okay, and what happens with this disease, it's a disease of the nerves where a person has deteriorated his or her memory, thinking, and reasoning. So the brain actually, parts of the brain will shrink. Okay, healthy brain will be full intact, but the shrunken parts of the brain, there will be plaque that will be built up, dying neurons with tangles in it. So the person actually has problems within the brain. Okay, so it affects their thinking and their reasoning. Okay, and they forget things. So that is one of the diseases that you can do for the project there too, is that one, which would be Alzheimer's. Okay. Another one is called sclerosis. Okay, and this is also known as Lou Gehrig's disease. You might have heard that name. He was a famous baseball player. It was named after him. So it's a disease that breaks down motor neurons, which results to the loss of ability to move any of the muscles in the body. So it's a really sad one. They also call that ALS. Okay, as a name for it, sclerosis for that type of disease. So they become kind of like almost paralyzed. So someone healthy that's active playing sports in their lives, like he was a baseball player, to someone that is kind of restricted to a wheelchair that has a very hard time moving. The muscles become very weak and they lose a lot of the muscle mass and the ability to move the muscles in the body. So that happens there. Okay. All right, Chris. You still have time in here. We still have about 20 minutes till you can get to Miss Wiedemann's class there, so you can just hold on for that one right now. Okay. All right. Next thing that I want to talk about is the next disease here. After that is I mentioned this one last week when we were talking about we talked about the what was it, respiratory? No, that was circulatory, circulation because of the nerves. But this one also has a play to it. Is carpal tunnel syndrome. Okay, so it's a disorder that it's caused by the compression of the wrists. All right, that's from the nerve supply to the hand, causing numbness and tingling, and it's a nerve disease. It's from probably playing too many video games over time, to texting too many people, typing, sitting in an office, typing over long periods of time. That's another nervous system system type of disease that you could research there too. So carpal tunnel is another one there. All right, another nervous system is one called epilepsy. You might have heard of that one before too. It's a disorder of the nervous system where a person has seizures and often involve convulsion and loss of consciousness. So that is another one that affects the nervous system, is epilepsy. Okay. All right. So just kind of just going through some basic ones here, and I'll get a little bit more detail into some of them as well too. Okay. Huntington's disease is another one. It's inherited disease. Get it from your parents or grandparents. All right. It's passed down through your genes. And it's progressive disease causing uncontrollable physical movements and mental deterioration. Okay. So one called Huntington's disease. So the brain from Huntington's disease, it has it kind of also is like similar to Alzheimer's, where it kind of shrinks in size and the ganglia, some of the neurons inside the brain. Okay. All right. Another one is very common that you've probably heard of is a migraine. Migraine headache, believe it or not, is a nervous system illness or disease, more illness. So it's a particularly intense form of a headache where your vessels in your head, your blood vessels, abnormalities are a component of the vascular headaches, such as migraines and cluster headaches. So it's from some of the blood vessels coming up to your veins, through to your brain, causing the intense pain in your head. Okay, so that is one that's going to affect your nervous system there too. All right, Parkinson's disease is another one. You may have heard of that one too. It's a progressive disease in which cells in one of the movement control centers of the brain begin to die, resulting in the loss of control over speech, head, and body movements. Okay, so some people that have it, they have a hard, they kind of walk, forward tilt of their trunk, reduce arm swinging. They kind of have like a different type of gait, meaning their walking style. They're kind of hunched a little bit over, trembling a little bit. Their hands and their feet will start to tremble, okay, of their extremities as well. You may see someone kind of shaking that way. That's Parkinson's disease. All right. All right. Am I pretty good on here? I'm not frozen or anything. I see someone say you're frozen again. Am I not frozen? Give me a thumbs up if I'm good. All right. Okay. I'm good. All right. As long as you could hear me there. All right. Excellent. All right, another type of nervous system illness is amnesia that you could research. This one is a kind of this kind damages the effects of the memory caused by damages to the frontal lobe. Sufferers have memory blanks where relating to past experiences in life and so on. So those are some there that could be part of that one too. Okay. All right. Um, Another one that is called cerebral palsy, you might have heard of that one too. It is a lack of oxygen or injury of a newborn baby can affect the abilities of a child to use and control his muscles or her muscles. So the sufferer usually has problems in walking, talking, moving his hands, but has normal intelligence as well. Okay, so those are some for that one. All right. Another one called aphasia. Aphasia is a type of brain damaging effect that communicates abilities of a person. So this range from inability to construct a sentence, either voice or on paper, to an inability to recognize speech itself. So this happens when there's a damage to the frontal part of the brain as well. Okay, so difficulty understanding, speaking, difficulty writing, they call that aphasia, loss of words. Okay, so that is another one there. All right, so these are some ideas here for that. Okay, looks like we got someone else, Alex, tuned in here, so thanks for coming on, Alex, as well. Okay, any questions so far about the project? Okay, so just so you know, I'm just going to kind of review it with you here. Um, you to research a nervous system illness or disease, write a paragraph about what the disease or illness does to someone, what are their symptoms, what kinds of treatment they need, how long will it last, along with the life expectancy. Some examples of the nervous system, or I have it on there circulatory because I kind of copied and pasted some of it. So would be cerebral palsy, amnesia, the ones I'm talking about right now, Parkinson's. No, you don't have to draw anything. There's nothing to be drawn on this one here. Okay, so cerebral palsy, amnesia, Parkinson's disease, epilepsy, Alzheimer's. Okay, um, you could choose other diseases, but these are the common nervous system illnesses. So, vocabulary for this unit, you could include some things on neurons, axons, dendrites, cell body, central nervous system, peripheral nervous system, cerebrum, cerebellum, brainstem. Those were the parts of the brain. You could also mention those in your research there with that too. Okay. All right. So I'm just covering over some types of illnesses with you guys. All right, I'm going to go into some detail on some other types of illnesses. One called a stroke. Stroke is not only cardiac, but it also could have problems. A hemorrhage stroke would be a blood vessel in the brain. It ruptures and bleeds. Okay. Risk factors are hypertension. Aneurysms could stem from that as well. So there's other types of strokes too for blood clots. that can happen. They call that thrombotic stroke. So stroke is in one there too. Some signs and symptoms: severe headache, dizziness, confusion, appearance of the gait changes. Those would be some things there. All right. All right, so I'm just kind of going through each one of this. Encephalitis is another type of nervous system illness here too. It's a virus carried by insects from fungi and protozoa. So seizures, fevers, muscle spasms, paralyzed, paralysis, they call that, confusion, coma would be some signs and symptoms. The diagnosis could be history, CT scan, MRI. Treatment could be stuff like rabies vaccine for that as well, or other types of antiviral medicines. All right. Some other types of nervous system illnesses that could affect the nerves is meningitis. Okay, it's a virus, bacterial that could that stems from a virus or bacteria or fungi. Some signs or symptoms are headaches and fevers, nausea, vomiting, seizures. Those are some things there that could signs or symptoms for meningitis. Some diagnosis. They could have examinations for that too. Antibiotics would be a treatment for it. So those are some things there for that one. Okay. Brain abscess could be another illness there too for the nervous system. Okay, looks like we got Jasmine and Chris. Chris, you mentioned if we have to draw anything. No, you don't have to draw anything for this section. Okay. Just writing a research on a type of nervous system illness. Okay. All right, I'm going through a couple more here. These are some of the diseases I've been talking about. The next one here I was talking about was Parkinson's disease. I talked about that one earlier. I mentioned it to you. So some signs and symptoms of Parkinson's: resting hand tremor, like where you start to shake, muscle rigidity, mask-like facial expressions. So they have different kinds of facial expressions as well. Quiet, soft voice would be one. Drooling, sometimes possible dementia, they would forget things. Okay, some signs and symptoms for this here and treatments. There's some medications that can help with that, like dopamine, oral secretions. These things will help from some of the reduced tremors. All right, multiple sclerosis, MS, is another one that will affect the nervous system too, an autoimmune response. So these triggers infections and pulses or infections and viruses. So inflammation of the myelin sheath would be an example for that there too. Some signs and symptoms for this could be weakness, fatigue, muscle spasms, tremors. Those are some hearing loss. These are some that could fall under that category. Okay. So for multiple sclerosis, others disorders may be ruled out. MRIs and CT scans, that could be a factor there too. All right, and ALS, I was talking about that, Lou Gehrig's disease. So it's a hereditary. It's only caused about 10% of the cases, so it's a really small chance getting that, but it affects motor nerves, so muscles, weaknesses, and fatigues. Begins in extremities, progresses to the trunk and head, and that would be some indications of that there. So that's muscle biopsies could also play a factor in there too. Dementia would be another one there as well. Okay, that's like forgetfulness and stuff like that. All right. Sam, you wrote there, can you copy and paste information? That is considered plagiarism, so don't copy and paste anything there. So take that information and put it in your own words, okay? So that's your question there. Can we copy and paste it? Okay, so yeah, make sure you put it in your own words. That's kind of like cheating, so don't copy and paste it. You could take some of that similar information and turn it around, okay, where you're getting at, but put it in your own words, okay? Okay, so dementia would be another one there too. of a nervous system illness. So it could be from some contributors to it. It could be advanced in age, genetics, some viruses, diabetes, brain infections, alcoholism could be a part of that. Huntington's disease, that could be some indications with that. All right, dementia as well. Signs and symptoms, patterns of onset depends on types and causes of that. All right, and there's a couple different stages to this. Okay, CT scans as well, MRIs could be for dementia, and those could be some things that help get information on that. So treatments for that could be underlying causes and so on. And Huntington's disease, one I mentioned earlier there too, that can be inherited. Okay. It could also affect the gait and appearance, that as well. Dementia. There's no cure for that. Okay, spinal cord injury. If you're in a car accident, that could be another one there too that you could research. Spinal cord injury. So I'm just giving you some examples of them. Skull fracture as well. So there's a whole bunch. There's a lot of resources of these out there. So any other questions or comments on this for the project? Again, I'll read it to you one more time. Don't forget Brain Pop is due on Friday as well. So both of these will be due Friday. Okay. All right, so I'm going to read it to you. Research a nervous system illness or disease and write a paragraph about the disease or illness does to someone. What are the symptoms and what kinds of treatment they need and how long will it last with life expectancy? Some examples of the circulatory illnesses are and diseases are cerebral palsy, amnesia, Parkinson's, epilepsy, Alzheimer's disease. You could choose other diseases, but these are some of the most common nervous system illnesses. All right, so other things that were included in this unit are neurons, axons, dendrites, cell body, central nervous system, brain, spinal cord, peripheral nervous system, cerebrum, cerebellum, and brainstem. So those are some of the most common ones there. Okay, any questions here? I am going to wrap up a little bit early today. I have another meeting, so if there's any questions, I will be back on at 1 o'clock today. So just reviewed parts of the nervous system with you along with the diseases. And I'll be back on at 1 to answer any more questions that you may have. So now's the time to ask me any questions. I know there's a handful of you guys in here, so if you need any assistance on anything, please ask, okay? So your paper, the paragraph will be due by Friday. All right. Thank you, Peyton or Allie, and thank you, Kylie, for checking in and getting that information. And then I'll be back on at 1 o'clock if you have any more information there too. Okay, we'll see you there, Jasmine. We'll see you there, Sam. Come back at 1 if you have any more questions. I'll be back on at 1. All right. Thank you for checking in. Okay, guys. I'm signing off for right now, so I will see you guys at 1 o'clock if you have any more questions. All right, guys. Have a great rest of your day. Projects due Friday, and I'll be back on at 1 for kind of reviewing parts of the nervous system and the nervous system diseases. All right, guys. Goodbye.